Thank you all for joining us for the interactive session on how to streamline revenue cycle management. I'm your host for the day and customer success manager here at Capline Healthcare Management. Let's get started and dive deep into how we can streamline or effectively manage your revenue cycle management for the practices. So it's a brief introduction about who we are, what we do, and what we are good at. So we are Capline Healthcare Management. We have worked for more than 700 practices across 50 states. We are headquartered in Houston, Texas, and we possess highly skilled team, and we have experience in successfully managing thousands of practices across the United States. Now, today, our goal is to understand how we can effectively manage revenue cycle management, and this can be done through effectively managing through four different pillars. So, first is educating healthcare practices on financial empowerment. Second is improve understanding on healthcare billing complexities. Third is offer strategies to optimize revenue cycle management. And fourth and the last, promote growth and sustainability of healthcare practices. Now, what we actually mean by streamlining revenue cycle management, this is basically divided into multiple pillars here, but we'll go through them all one by one. So there are some key factors to it, just like ensuring timely and accurate reimbursements, then denial, rejection, analysis, and prevention strategies, maintaining KPIs as per industry standard, and ensuring data privacy and security, then ensuring your patient's satisfaction, and lastly, staff training and development. Now, we'll go with all these six parameters one by one so we can understand how we can implement them effectively into your practices. So first we talked about ensuring timely and accurate payments to the providers. This is further segregated into four parts. Let's understand them. First and the most important is reducing billing and charging lags, streamlining eligibility and benefit verification process, then adhering to billing and coding standards, which we should be very much accurate with, and lastly, trying to minimizing denial. Now, these are some basic, this good to know information, which I would request you all to go for. I'll keep the screen freeze here for like 30 seconds. As we talked about denial and how to prevent them. So let's understand how we can actually go through the denial and rejection analysis and how we can actually frame their prevention strategies. How we can work towards denial prevention, some basic steps involving in it are categorizing these denials first and foremost into two categories, true and false denial. Then setting up our own checklist before we can actually file a claim, before we start filing up a claim. Third is learn always from our past mistake. What was the reason of any particular code getting declined or any particular claim being denied? Then, using a strong tracking mechanism, we should start collecting the data and implementing them into our future claims or future strategy. Then, some common denials are like untimely filing, non-covered services, which we are submitting along with our claims, which are actually not covered on patient's insurance. Then, missing referrals, authorizations, and missing information. Then I would request you to go through some basic good to know information, which we actually again got through some basic survey. I'll freeze the screen here for like another 30 seconds. Just go through it for good to know information. Now, we did study about the denials getting very common these days in practices while submitting the claims. Let's understand some basic reasons of surge in denials all of a sudden. So lack of resources, staff training, and attrition, which is actually killing the revenue cycle management and denials. And then growing denial backlogs. So let's understand the challenges of the practices that are facing denials and how we can manage the denials and how we can work towards it. So we did actually a survey for some of the practices we are actually working with. And we were surprised to see at some of the facts and figures. Let's go through them one by one. So 62% of our practices, they actually said that their organization did not have sufficient data and analytical technologies to identify submission issues. 61% cited lack of automation in their claim submission and denial prevention process. That was their main problem. Then 46% said actually the lack of staff training was one of their top challenges, which I actually did said in some previous slides. 44% had lack of in-house expertise in denial management. And 33% of respondents said that their organization's technology was actually out of date and they had inadequate for effectively managing insurance denials. And lastly, 30% actually said that staffing shortages were key factors behind their claims getting denied back to back. Now, how you can maintain your KPIs of practicing as per the industry standards. Just go through some basic percentages for clean claim ratio, denial ratio, days in accounts receivable, first pass ratio, net collection versus gross collection ratio. So these are basic industry benchmarks. Not sure that you would be meeting them or you can be exceeding them as well, which can be actually good. But these are basic industry benchmarks. Now we talked about some six factors that can actually help you in reducing the denials or improving your revenue collection cycle. One of the most important factor in it is ensuring patient satisfaction. First is that higher patient satisfaction will actually increase in your clinical visits. And higher patient satisfaction can actually help you in getting referrals, which can actually help in boosting your patient's footfall. Ensure that we are effectively working on privacy and security. So importance of strong data privacy and security in digital age, that's one of the most important factor. Second is breaches can damage a patient's reputation and diminishing patient's trust. Third, decreased patient trust can lead in reduced footfall, and that's something no one would want, neither we nor you. Now we have done some case studies. From here on, I'll take you through some slides, which will actually give you some case studies regarding change in healthcare breaches, about cyber attack dates when it actually happened. That was actually one of the dent. Then attack is data when data was leaked, major data leaks we are talking here about, ransom demanded. So these actually happened with some practices wherein there was a data breach. So again, we're talking about implications here for service disruptions, legal and regulations, financial impacts, security and compliance reviews, possible mitigations, including enhanced security measures, rapid response plans, regulatory compliances, education and training. So basically, whatever case studies are here, we have already talked about them in the previous slides, why they're important, how we can actually implement them in strengthening our pillars when it comes to revenue cycle. We also talked about staff training and development, which is actually very much important so that they are actually up to date with the major changes that happen in the insurances at their back end, so that they can actually help in implementing and improving your revenue cycle and lowering the denials basically. So let's talk about now open EMR. You know how important an EMR is these days, which can actually help you in collating the claims, working on the claims, and submitting it to the insurance companies. So let's understand EHRs, what they are actually, and how they can be beneficial. Firstly, electronic health records, EHRs, are digital versions of patients' paper charts. They contain comprehensive medical information, improving care coordination and efficiency. Then EHRs, they actually replace the traditional paper-based system and allow for better data sharing between healthcare providers. We did go through the introduction to open EMRs. Let's go through we did read about the EHRs. Let's go through about open EMRs now. So open EMR is a cost-effective and open source electronic health records and medical practice management solution. Basically, it's a software again. And open EMR has a silent security features to comply with HIPAA regulations. Some key features of open EMR: electronic health records, which are termed as EHR, then practice management, electronic prescribing, and patient portals. Some other key features of open EMR are like reporting, multilingual support, supports industry standards such as HL7 and CCDA. These are multiple. So like we were talking about EMRs, the open EMRs, we at Capline, we have developed in our in-house open EMR software, which many of our providers are using. And just to give a brief on what they are and how they can actually help you in boosting your claim submission processes. So for healthcare providers seeking a flexible, cost-effective, and community-driven EHR solutions, for those who want to be able to customize their EHR to the exact specification of their practice. We can actually customize it as per your needs. So, healthcare compliance in modern healthcare. Let's understand what compliances are. What are the various compliances basically when it comes to healthcare industry? So basically, healthcare compliance refers to the policies and procedures that healthcare organizations must implement to adhere to federal, state, and local laws and also regulations. Secondly, it is essential for protecting and preventing patients' privacy, ensuring data security, and preventing fraud and abuse. So key areas of healthcare compliance, they are in front of you on your screen. You can go through them. They include HIPAA, high-tech, anti-kickback statutes, and stock laws, fraud and abusive prevention, basically. So let's go through and understand why healthcare compliance is actually important. We did read about the compliances. Let's read and understand why healthcare compliances are important. First and foremost, compliances build trust with patients by demonstrating a commitment to protecting their information and providing ethical care. Secondly, non-compliance can result in significant fines, penalties, and even criminal charges. Third, implementing compliance measures can streamline processes and improve overall efficiency. And fourth is a strong compliance program enhances an organization's reputation and credibility. Now, we talked about how we can implement them, why compliances are important in healthcare industry. Let's understand the challenges of compliances. First, staying up to date with and evolving regulations can be complex and time consuming. Secondly, healthcare organizations need expert guidance to ensure they meet all compliance requirements. So, why implement our healthcare compliance program? We can actually assist you with it and why you can go for it. Capline offers comprehensive consultancy services to healthcare organizations to navigate through the complexities of these compliances actually. And that's where we can step in and make it easy for you. So talking about all these, what our services include actually, just taking you through them. So risk assessments, policy developments, training and education, if needed, we can take care of that, auditing and monitoring, and we can guide you on HIPAA, high-tech, and other regulatory requirements. Now here, I would request you to go through some testimonials that are already present on our website, on our Google page, on our BBB portal. You can go through them, just understand what clients have to say about us. I'll freeze here for another 30 seconds. Great. So that's all. Let's wrap up this interactive session. Great. So thank you for joining this session. Soon, everyone who has joined and did enroll for this webinar will receive the link for the recording, whatever we discussed. They can keep it in their mailbox and can go through it whenever they want. And stay tuned for our next upcoming session, which one of my teammates might be taking you through. Stay tuned to what we have to discuss for the next time. Till then, take care of yourself.